Good morning or afternoon. Welcome to this week's Telehealth Secrets webinar. We're going to be talking about how to successfully engage your not your parents, although many of your patients are parents, engage your patients even after COVID. So my name is Anne and I'm our events coordinator. So just a few quick housekeeping announcements before we get started. Yes, this webinar will be recorded. So just look in your email for slides and recording. Check your spam filters. Also, you should see a chat box somewhere on your screen where you can submit your questions and comments anytime during this presentation. There's also a handout section underneath the questions box where you can download today's presentation. We'll do our best to get to all your questions during our open Q&A time. Also, if you like this webinar, we have tons more like this in our VSee.com secrets. We talk about things like big data, marketing to your patients, telehealth regulations. So feel free to jump over there. And then finally, I'm really excited to announce that we're going to be at HIMSS this year in person. So, our team is just kind of biting at the chops, or I think I'm mixing up my chomping at the bits. There we go, mixing up my metaphors. Chomping at the bits to meet you all in person. So, please, I'm going to send a little link there where you guys can contact us to do that. And mHealth Mobile with Chris Nicholson here, they will also be at HIMSS. So both of us will be there. We'd love to meet you. So without further ado, I'm going to hand the time over to our Telehealth Secrets host, Dr. Milton Chen.
Thanks, Dan. Welcome everyone to the Telehealth Secrets webinar series. I'm Milton Chen, I'm the CEO of VSee. We're the telehealth company behind Nicholson, Optum, DaVita, GE, and the NASA space station. And today, I'm super excited. So you guys probably hearing the buzz of how AI and just will transform just everything from patient engagement to everything. We're super excited to have Chris on the line with us. So Chris Nicholson is the CEO, co-founder of mPulse mobile health engagement platform. So Chris has been in the business for transforming healthcare for well over 20 years. He's been in the leadership role from startup to a Fortune 100 company, including a longtime VP and COO of wellness at Humana. And some fun facts about Chris is, so he and his family spent a month living in the RV, traveling from Kentucky to LA to join mPulse Mobile. So how was that experience like, Chris?
Thank you. Yeah, it was funny. It was sort of the funny founder story is that when I told my wife that I was going to quit my job at Humana after being there for 15 years, and she said, well, before we move, to California, let's see if our house will sell, right? Let's put our house in the market and see if it'll sell. And then we ended up getting, I think, 3 offers, and our house sold in the first, 3 days or so. And that was the sign that basically said, okay, let's go. So we had a large Class A RV. My kids were sort of 5 and 7 years old, and it was the perfect time to sort of jump in and travel and take some time to clear your head before getting involved in this crazy startup world, right?
Oh, awesome. Actually, I love RV. I think on my last trip, we family rented an RV. I went to Yosemite. I think it's a great way, to just clear out your head. And
absolutely.
Okay. So, Chris, how about I'll turn the floor over to you, and we'd love to hear about what mPulse Mobile you're thinking afterwards, and we'll open up for the audience for questions.
Yeah. And can everyone see my screen okay? Milton, are you good on that end?
We're all good.
Right. Perfect. Well, let me jump in, and I'm just appreciative of the team and Milton for setting it up, and I think just creating a dialogue, these types of topic areas. And so I'll spend 10 minutes or so and kind of run through a little bit about mPulse and some of the things that we're seeing as trends. I'll try to be really specific even on a few use cases, that are supporting the provider ecosystem here and really engaging, their patient populations. And so real quickly, just about, mPulse is that our sort of, mandate and our vision is really to help improve health equity through personalized engagement strategies. And we like to talk about this in terms of shifting, from what was sort of a campaign-based world of, the way engagement was done before, which was sending kind of the right message at the right time type of a piece, right? But then actually getting to more of a conversational strategy. And so, when we talk about conversations, means there's a response and there's engagement in these different turns of a dialogue to actually capture and learn, that we've really found some great data that helps build trust through sharing this particular, knowledge as well. And so, we really want to meet people where they are in this journey. We want to uncover barriers through dialogues. And I'll show you a few examples of these, and then ultimately, build trust to improve those outcomes. And so, we'll talk a little bit about those pieces. From a strategic perspective, when we look at, our goals is to really focus on reimagining health engagement. And that's built on these conversations I mentioned, knowledge and learning. We recently acquired a company that was called The Big No, that was focused in sharing knowledge, almost like the TikTok or YouTube videos for sort of healthcare content and healthcare engagement that patients could quickly engage in. And what we found was we needed to give people something back instead of always just asking for information. Give me your cholesterol level, when would you need to reschedule that appointment to, and sort of always asking. And we thought we needed to share some value in that equation. We'll show you what that looks like as well. And then journeys and then outcomes, and the journeys and the pieces that actually lead to that work and those workflows as well. And I think that the challenges that, we saw, and I think that, most of you on this particular phone call can resonate with, is that, the engagement component with the patients is that defining factor to being able to improve clinical outcomes and manage cost. And you can't, drive those factors forward unless you have a really good handle on how to engage patients. And, the pandemic and sort of this post-pandemic world that we're in changed the way that we have to engage, these populations. And I think for, companies like VSee and for others, it really helped accelerate the strategies that we were on before by driving much more to a digital first or a virtual first strategy. And so, it helped us change, regulations, move up that sort of continuum, and reducing the barriers to engagement and these improved access points as well. And so, those were some of the strategies that became really critical. For us, the way that we sort of attacked that in this digital first model was to leverage this conversational chat, these dialogues to engage patients, to help steer them to the appropriate services, right? Improving access for a lot of underserved populations. And you can see a few examples in the bottom left there. A lot of, notifications of where people were, where they could get immunizations, access to telehealth services, making them aware of mail order, and then again, uncovering those S2H barriers. And so these dialogues start out with a very open-ended conversation you see on the right-hand side of the screen there. And this is getting someone to a breast cancer screening, preventive services, others, and then actually maybe driving to, again, that digital first or telehealth solution. And you can see here, the individuals may reply back with, no, I'm healthy, I don't need to go, I feel fine, or, I did a self-exam or something to that effect. And you don't really then kind of move them to the next level. And so you can't accomplish this with an outbound IVR call. You can't accomplish this with, emails or other factors. And then our responsive engine actually allows for you to say, oh, we see that this is a particular barrier, we understand, and we want to then give the recommendations that says, well, you should still make one for these reasons, even if you feel healthy, et cetera. We also learn about barriers to like medication adherence, where someone says, well, I want to get the medication, but I just don't have transportation, or I can't afford it this month because of some other expenses. And so you learn about those things through these conversations. And what's really relevant is you hang on to that information. So the next time you engage Jane regarding her health, you already know that there's these different barriers or S2H challenges that may be really inhibiting, those objectives that you have and goals that you're working with that particular patient on. So, in this world, I think what changed, as we connected with, different partners and, thinking about, the outlook for telehealth and where we can help support that model, is obviously the shift from, the utilization. You guys have all seen the results and sort of the drivers and the value of telehealth through these different solutions. McKinsey and others have some great, reports on this. But obviously the regulatory environment made it much easier, as a solution area. And we're seeing so many of our even health plan partners today that are then saying that they need to go to a virtual visit type model first. And so they're trying to build structures that actually enable that to be the first line of defense or the first line of care in these models. And then obviously our provider partners, which are leaning into that as well to sort of maintain it from a cost structure and access points. And so what we did, I'll use an example very specifically around COVID and vaccination engagement, building a solution that actually tried to pull in these different components to get people to sort of answer those questions that are coming up, reduce those different barriers to engagement and give them the tools and resources from a knowledge perspective to actually get there as well. And we actually refer to that as this Live Well Vaccinate was the program that we were defining, and really focused on dispelling myths. There were so many myths in the space. We had our provider partners that were trying to get people to these appropriate services, but we need to clarify process, improve access, and then most significantly boost confidence and trust in these different capabilities, which was part of that exercise as well. And so what that looks like, I'll sort of skip this piece just a little bit, but empower the people that were ready, right? People that were already there, just give them the tools, and then educate those that were unsure about actually, do I get immunized or not? Based on my age, based on these other conditions, based on family members, and then just really provide broader, engagement for the wide population. And then I'll get into some of the results that we see there. And so from a scale perspective, we did last year and the beginning of this year, about 30 million messages specifically just around COVID vaccination. So you can think about the timing as that didn't even really become a topic until sort of the early part of this year, kind of December, as we were prepping people for that exercise. Population of about 10 million, predominantly Medicaid, Medicare, members and sort of seniors and some underserved that are flowing through these different provider facilities, and about 200 different programs that are there. In the deck, you will have access to this, and you'll actually be able to get to the video link that shares some of those workflows and strategies as well. And I'll come down to the view of what that actually looks like here. So you can see in this journey and creating this sort of interactive model to sort of be a launching pad to others is using these conversations and what we refer to as conversational AI or NLU to then connect. And so, do you have questions about COVID? Are you curious? Do you plan to get it, et cetera? Again, very open-ended. Individual says, yes, I'd like to learn more. You're off to a great start. What are you most interested in? So let's clarify. Let's actually have that conversation and really tailor the dialogue versus saying, here's a portal with lots of information, go figure it out. And so then we steer to these services they were interested in side effects. And then again, are these sort of, TikTok or YouTube type, snippet videos that are tailored to that particular dialogue based on this context model, and then allowing them to go into the learning centers and then continue to dig in, from subject matter experts and assessment of resources to be able to continue down that learning journey. And so, a couple of things that you sort of see play out there, I'll sort of go to one of the snapshots on the knowledge side is getting to, the value and sort of the operational side, right? So how do you reduce appointments? How do you get people to appropriate appointments? How do you improve aid engagement, whether in portals or, in other tools? And then most importantly, I think is the piece that we're really excited about is then using this to capture barriers and understand the dynamics for those particular individuals, so that again, we can be smarter in the way that we engage them, because we know that if we learn a barrier about cost or another challenge, but we ignore that and just continue to message versus have a conversation, patients will tune out, and we want to really protect it and again build that trust in the network as well. And so as we use these different tools, you can see whether it's in scheduling, confirming, using a mix of capabilities from mobile web, secure messaging, and others to get people to those different services, and then again bridging to telehealth or virtual as part of the core strategy there from a team perspective. And so you can just I wanted to put this slide in while it's a little bit of a snake here. It just shows all the different touch points from a patient journey perspective where there's the ability to engage, and then doing that, I think in the right way, in the most appropriate way as you move through. And you can see here, obviously, streamlining, getting them to services, from a telemedicine or remote patient monitoring is that, our goal is just to be sort of enabling capability to support programs like, and solutions like VSee to get people to these services and support that provider experience as best as possible. So I'll kind of, close here. I'll give just a little bit more on the content side as you think about the dialogues, and then I think the care journeys themselves, because I wanted to touch on, Milton, highlighted before in one of the messages around, the SDOH and those barriers. And I think it's when you start the conversation in the care journey and you capture a lot of insights about these different populations, again, you need to take action to maintain that level of personalization. And so, whether we're looking at SDOH from census tract or zip code level or others, we need to know that they have services available in those areas as we're sort of, again, tailoring these dialogues and then moving them through, to that most appropriate channel, but again, more importantly, the most relevant content. And so, so I hope you can really see that the balance between what we're learning about that particular individual around preferences and outcomes and sentiment through these conversations is that sort of, the really powerful part of the process. It's not about being able to send a message. It's not necessarily even about the channel. It's about actually being able to sort of have a dialogue that creates trust, that captures information and insights that we can use to, better personalize and continue to drive the outcomes that we're looking for with our partners there. So mix of services, engaged across, the provider, community around med adherence and closing gaps, health literacy, and these different tools. But I think you'll see all of these different pieces come together through this exercise. And so, with that, I'll stop there. I'll sort of stop sharing. I'll sort of bounce back, and I'm happy to pull up any slides. Milton, if we've got questions about any of those areas for us to come back to. But hopefully that gives a bit of a view. And Milton, happy to dive into any areas more specifically that you want to make sure that we're covering around, boosting vaccinations, driving engagement. Let me know where we want to go.
Chris, thank you so much for that. That was very insightful. I think we have a quick poll to there. How about? And I guess it's, for the audience member, we just want to do a quick poll. Maybe you can select that, and then we'll show the results.
Are you seeing that? Okay. Oh. Let's see. Okay, so we're are you guys seeing are you seeing the numbers? Are you seeing the
Not the stats, just the question.
Okay. Well, I think we're getting there. Let me see. Okay. All right. So what we have, I'm just going to say it because I'm not quite sure why it's not showing this time. So we're having, so we've got 39% so our winner right now is 38%, it's changing. 38% getting patients on technology. 35% is the next one, using the right channel to reach patients. And then the 16% tailoring the right content to patients. And then 11% not enough time to interact with patients individually. So it's kind of a tie between getting the patients on technology and using the right channel to reach patients. So I'm going to go ahead and close the poll now. Yeah. All right, thank you.
Great, and thanks. So Chris, I think for the audience members, please feel free to start. Okay, and now we see the results. Yeah. Okay, and if you go maybe switch it back to the other view. And for the audience member, please feel free to submit your questions. I will direct it to Chris. So we're pretty honored to have Chris sounds the expert of the industry here. And I guess, Chris, I was sort of like, so you talk about like the social determinant of health into this. That was really intriguing to me. I know, like in the traditional model, right? You get sick, you book appointment, you're sick, 5-10 minutes, you're out in there, right? So now the alternative is people, right? They're sending nurses, medical assistant to a home visit to really understand, like,
Mm-hmm.
on from what you guys doing versus like an in-person, that is how how close can you, like, if let's say that in person spend an hour in the person home is the gold standard, like how close can you get to that in terms of understanding the,
Yeah, and what's interesting with messaging, and I love that one of the topics came up was like, what's the right channel and those pieces. We can actually capture a lot of very personalized, data through that. So again, there's preferences, there's the opt-in with that. But when we've done things like health risk assessments, for example, we've done, home health assessments for individuals over digital, and sometimes we'll shift it from an SMS to a secure messaging platform to be able to do that, like in a mobile web environment or something. And we capture a significant amount. So where you're doing assessments where individuals can send in pictures of their home environment that can be shared with a provider, where you're asking about, conditions in the home, who's living with you, all of those types of things that are there. Do you have access to, transportation, for those particular individuals? Health risk assessments are highly valuable, but what we typically do in sort of this digital world, though, is we don't do it as like one long survey, that's
yeah,
sort of all concurrent. Is today we may ask you 2 or 3 questions, and tomorrow we may ask you a few more, and we'll sort of build that a little bit but we'll set the expectation with the patient around what they're actually going to engage in. And so that's a great way to actually build that. We've done a lot with like medication therapy management and, understanding what medications people are on, versus the schedule, other supplements, other things that may come into play that have been really interesting as well. But it's really, again, the partition. We can see in the data if Milton, if you're responding, if you quickly respond to each question, we'll keep going. We'll give you another question. If we see that the time between your responses starts to go longer, we'll then say, hey, better to take a pause. Let's use some behavioral model. Let's move out and pick that up later on. So just some insight.
That makes sense. I guess I was curious is, have you done study where could you replace that in person? Like how good could you get versus like,
Yeah. We haven't there. Most of the solution areas are trying to sort of help augment the provider partner's need. And we have a tool actually called the Engagement Console that allows for like a one-to-one live chat even. So we'll do as much as we can virtually, but some of our partners say, hey, if they actually want to ask some questions that says, you know what, I took the medication, but I have these, perceived side effects with it. And they may say, great, those words, we want to go over and actually talk to them live and have a care team connect, and we'll bridge to a live agent. So we're typically automating kind of 85, 84%-ish or so of the conversation, the dialogue, but there's those special cases where we want to connect to, a care team.
Got it. Okay, got it. Makes sense. How so right now the AI what you're doing, you're on probably like the hardest thing there. Right? I think there are a lot of hype and also a lot
I don't know if it's hotter than telehealth, actually. I don't know if it's hotter than telehealth.
yeah, the telehealth a lot of hype too. Like, what what's your thoughts on, like what is, like how such a technology that go through that valley, like they're like, what do you believe are like some of the stuff that people are doing that's actually is too much hype, is not that good versus some, like I think the stuff you're doing is really, really useful, right? This is like clearly useful. I
Yeah.
was just curious like your general view on the whole
On the
AI.
whole thing. Yeah, I think there is a lot of hype. What I've seen is there's a lot of like AI kind of in like what I refer to as like more like operational processes, and I'll see things that'll say, oh, well, this is the new AI engine for, booking travel, or this is the new AI engine for something else. And like there's a point where you're like, is that like a really big hammer, that may not be necessary in that case. But again, if you can use it to pull those insights or data, that there's some, behind the scenes value, from that perspective. I've seen an interesting trend where a lot of even health plans and large provider systems are, I've seen a couple now that have hired like a chief AI officer role. And so you like, what are they going to do with that, right? I don't know exactly, but it's interesting to see that they're making that a key executive role in the organization.
Got it there. How about in terms of when you do the AI for the mPulse mobile, are you mainly chat-based? Do you also do the voice-based? Like,
Yeah.
in,
Yeah, the majority of our AI is on the messaging side for text and for secure messaging. We have some that's embedded in the voice. Email is still pretty much email, and we just sort of think about the channels that's there. And then the newest channel capability, I know that came up as one of the areas on the poll. If individuals are familiar with what's called RCS or
okay.
ABC, which is basically rich business communications, or RCS, rich communication services, and then Apple Business Chat. And so those are two sort of retail type engagement capabilities that allow for conversational AI to happen with like app-like features, but never having, and I love at the beginning, you were talking about sort of reducing patient friction and kind of improving that experience. And the nice thing about that RCS capability allows you to have app-like functions in the dialogue, but it's really using the messaging app on the individual's phone. So they don't have to download anything, they don't have to go through an engagement. And so that's a trend I think we'll have to keep an eye on.
Got it there. So by the one of the problem in the slides you mentioned, like for example, solving this for like a patient no-show for the appointment. I thought that's a really nice application, your technology in there.
Yeah.
I think your number was that like without appointment, I think something around 20% no-show. Then you guys were able to improve that significantly. Do you feel like is there room for continual improvement? Like just how good can you? Because
Yeah.
eventually, I think the one thing is the technology just nudge. Another thing, just like the intrinsic, the person just like they
Right,
ignore.
right. To
How
push
could
that limit. Yeah, and we see it too. I mean, I think the things we're learning on the behavioral side there is that, you find where people are on that decision curve, that are more apt to schedule the appointment. The timing becomes really critical. It's sort of where actually, connect with someone, the time of day, little things you learn that are so subtle, like don't send people the message between 5 and 6 p.m. when they're on the commute home. You're not going to get a response. They're going to roll to dinner, this, that, right? You're going to get much better engagement between sort of 9 and 11. So there's little subtleties in where we've had much higher success on that. But on the appointment side, like pushing up the 40, 50, 60%, I think is absolutely possible across different solution areas based on the type of preventive service you're driving for. And so, we've seen some really, really good success there. And then what's nice is, again, if they identify a barrier like, no, I don't plan to, I feel well, etc., we then can say, let's change the engagement strategy for Milton because we know that this is the way he responds. And then that's what we're going to do, Milton, to continue to get the incremental value out of those different populations and continue to kind of put them in smaller engagement buckets.
Got it. Okay. Yeah, this is really awesome. So so Chris, I guess you guys been gone, on the tier, make a huge wave in the industries. And what are some of the next things you guys will be doing, like for people, like audience members to get excited about?
Yeah. I think I'd probably come back to the piece around RCS, that rich communication services, because we all hear about SMS, we hear about email, we hear about outbound voice, like the different channel mix that's there. I think it's significant. As far as the market change, and we're seeing some of the first really valuable healthcare use cases around scheduling and appointments, around medication adherence. And because you can really, like what RCS allows you to do is have this chat type conversation, but actually serve up a pathway. And I'll give you the simple example because probably most people on this call are in LinkedIn. So have you ever gotten a message in LinkedIn and it gives you suggested responses? Like it'll say, oh, it's Milton's 5-year work anniversary, and it'll pop up back and say, congrats, good job, nice, and it'll automatically sort of steer that, and you just click a button and move on. And so that I think is one of the biggest game changers about just reducing, the level of effort that a patient has to do to engage in healthcare by serving up those available appointments. They click one button and move on and can work through it. So I think as long as we keep being efficient for consumers, we're going to get traction.
Got it. That makes a lot of sense there. I guess when you do the AI piece in there, do are you based on top of any of these sort of building blocks, like things from Microsoft or Google or IBM, or do you guys purely just decide to build everything from scratch?
Yeah, our CTO Ron Praga is fabulous. We very much always look for sort of a partner strategy versus a build strategy. However, in this case, for the conversational AI, and we actually have a patent on what we call mCare, which stands for Mobile Content Attribute Recognition Engine.
Okay.
And Milton, you'll appreciate that's what happens when IT people make up product names, as it turns into something like that. Is that what mCare does? Is it's the AI engine, but we looked at Google, we looked at others, but we do like intent classifiers, we do sentiment analysis on that. And the tough thing was that most of those models for conversational that are built by the Alexas and the Googles that are playing out are very, very transactional, and B, they're very what I'll refer to as social. And so they assign sentiment, and the physicians that are on the call will not appreciate this, but doctor, for example, has a negative sentiment in Google's model. And so if I said, I'd like to speak with my doctor, or your doctor would like to connect with you, that negative sentiment would change our decision model, in that. And so it didn't work appropriately because of the type of construct that we were in. And so it broke more times than necessary. And we started building workarounds and said, let's just build it. So.
Got it. That makes a lot of sense there. So, Chris, what brought you into the whole AI journey? I mean, you've been executive for like years, was there a moment in time felt like, because AI has been around for like decades and decades, right? I think it's always like not quite ready. What made you decide now is the moment
to jump in there? No, that's a great question. I think it was interesting because I worked at Verizon and telecom before, Humana. I was at another technology startup company as a product manager. And so mPulse was sort of a great combination of like the healthcare experience from Humana, the mobile technology, and sort of those two things coming together to build this space. But specifically for AI, it's really a funny story because we were trying to solve one simple problem, in messaging. And I want you to try this. Anytime you get a text message from CVS, you get a text message from Apple, you get it from anybody, I want you to just respond back to the message and just say thank you. Literally, whatever it is, just say thank you. And with the most subtle thing, we were literally sending messages and doing the notifications of go get a flu shot. Your appointments are at 2. And it was so transactional. And we then started to look at the responses. We were so focused on outbound. And then we went, like, the epiphany was like, wait a minute, the inbound stuff is 10 times more valuable than the outbound, right? And so we were sending messages that said, I'm sorry, we don't understand your response, to a thank you. And I'm like, we cannot operate in that world, right? And so that was the model that said we have to shift the dynamic. Just that little simple thing was the trigger.
Yeah, I agree with you. Like, I know my dentist, send me this appointment in there. It's like, if I want to change my appointment, I have to go call them up again. Yeah, definitely.
Or you want to say back, you want to say thank you. How about next Thursday? And then we say, here's 3 appointments on Thursday, and you say, yeah, 10 o'clock works, right? And that's the way we should be continuing to model, right?
Yeah. So for your mPulse mobiles, is everything through this SMS space, or do you actually the reason why I'm asking is that SMS is not HIPAA compliant, so people go from SMS to these sort of like a HIPAA, but then you have to download some app or web page to chat, which is a barrier in there. Like how's the mPulse experience? Are you purely
Yeah, so we'll stay. We actually acquired an IVR company 2 years ago because we wanted to own the channels primarily from a compliance perspective. So we have IVR, SMS, push notifications if a partner has an app, so we can push through that particular channel, make sure they have the same message center that's there, or even in a portal. For the secure messaging, if it's PHI related and we're messaging, we'll have that text message as the initial trigger, and that will then launch into a secure session that then they don't have to download an app. It basically opens up that browser session for a temporary time, and then we effectively wipe that from the device. So if they come back in 15 minutes later or an hour later, based on the requirements of our client, it's not there any longer because that was the security window that was appropriate for that as well. And then And I think I mentioned, obviously the RCS piece, which is there, and I feel like I'm forgetting, email. And then email services are one that we still actually do a fair amount. But I would say today that probably 70% of all of our engagement is happening over SMS.
Got it, got it. So for the SMS, like how far could you push in terms of, because I heard like there's some controversial things, like for example, can you discuss like appointment, if this is, let's say I'm chatting with my psychiatrist, then SMS knows I have, is that okay? Or I guess what's the boundary between, you need to move off SMS versus you can continue SMS?
Yeah, it is absolutely okay, but there are 1,000 urban legends that say it's not. And so the driver actually comes down to the consumer initiated, the member patient initiated response. So if you're maybe messaging about, A1C and it's about diabetes, and the person says, I'm really struggling, I'm really feeling depressed about this new condition, right? And then they connect and they're having this dialogue that we may be engaging them and saying, would you like to get some, some behavioral health support? Your employer has EAP or work-life services, your health plan offers XYZ. You absolutely can engage in those as long as the member is the one that's actually making the initiation versus you sort of soliciting from those dialogues. And we'll typically even ask the question that just says, would you like to continue here? Or we can launch them that secure message, system to be able to do that as well. And then it's being done through that secure web chat, component. So there's just a couple different ways. We try to always push them into that model just because it's better for everybody. But you don't want to turn that customer off, because they're going to be really, really hard to re-engage after that fact. But and then there was also, the last thing I'll mention on this one real quickly is that there was the TCPA, which is the Telecommunications Protection Act. There was a ruling that actually was just reviewed that updated the ability to do outbound messaging, and text messaging previously fell under the Spam Act and under considered robocalls, but actually it was Facebook versus somebody, and that got undone finally, and they defined it because a robocall was a randomly generated engagement. And these are obviously not random. These are to patients and people who provided their mobile number, which is considered express consent. See how this turned into a call now. And then and that express consent allows us to then engage that particular individual. So.
Oh, excellent. Okay, so basically what you're saying is, for example, if there's some patient portal, some other ways, as a patient, I give you my cell phone number there. So as soon as I give that allow you can send to me SMS, without explicit otherwise permission. And during that conversation, if I bring up some topic, then you can continue to engage with me. I can stay on the basically I can stay on the SMS channel.
That's exactly right. That's exactly right.
Got it. That's actually very nice. So even if you were to discuss these or medical history very like detailed, that's still okay. You don't need to move off the SMS. Right?
That's right. And we still have customers that want to, right? They'll still want to drive to a more secure channel, which is fine. And we'll move them into a mobile web, or we would, in many cases, like with a partner like yourselves, would then say, this is a great dialogue. Let's set up a virtual visit, right? Let's connect, to your provider directly, or have that secure chat, that one-to-one asynchronous, chat conversation too. And so that's where I think it's trying to move them to the most appropriate channel for, that topic. So.
Got it. That makes sense in there. So Chris, one thing, like when you were in your talk about, the vaccine drive, I thought that was really intriguing because once you're getting all these, social determinant of health, those information. Then the other piece I was very intrigued, right? I think in the US, maybe it's like slightly controversial. You have this where like that 20% of roughly Americans who they will, not get it because they feel like this is for the vaccine coming from the devil or whatever things in your conversation, do you get into try to persuade some portion of people who will be otherwise vaccine hesitant to
We will, and I could try to look for a slide here. I'll take 1 second and see if I can find it quickly for the team.
Okay.
And see if pull that up here while we're I don't see that I have it handy here, but there's some great metrics that we were asking questions, basically coming back to the patients and members around this engagement level, and asking them why. Like, why do you not plan to? Do you plan to get vaccinated? What are the barriers to that? And the stat, and I might be off just a little bit, but I think it was 36 or 37%, were in the wait and see category. So they wanted to basically just say, I'm not sure, I want to see how it goes. And then so we said, well, how long do you want to wait and see? Like, what's the window? Because we wanted to see when it was appropriate to re-engage them. And most of them were like 3 to 6 months. And so we've sort of hit sort of a plateau a little bit in the US here. And then I think in the next few months, people will say, okay, well, Milton's DNA didn't get changed and he has the ability to see through walls or fly now. So I think that now it's appropriate. I'm going to go ahead and move to that, go ahead and get the immunization. And then we're seeing more and more data come out behind it. And then we asked the question around, like, what are the trusted sources? Where do you go to get information? And surprisingly, it's going to the web, it's going to Facebook, it's going to more social platforms, and through peer groups versus to, clinicians in many cases. And so what we did in that Live Well, that program, was actually connect them to the subject matter experts and trying to make it much more social feel so that we could create those points of connection on content for them.
Got it in there. It's almost, I feel like maybe the perfect thing we could do, although it's probably not legal in the US, is say, like, you're on the system, then you can figure out through your social graph, here's all the people who just got vaccinated.
That's right. Yeah, and I'll look for, here's that slide. Here we go. So if I do, all right, can you see? All right, do you see the measuring vaccine hesitancy on screen?
Yes.
Perfect. So this is a little bit of detail here from with the recent program. So this was data that was May 1, and you can see here that this was perceived. So this one was 57% said that it may not protect them fully. 31% said that they didn't even think it was available to them yet in May, right? 45% had fear of vaccines. And so, and then you can see obviously the distribution by age. Again, I got it already, right? 40%. I plan to get as soon as possible. And then you've got this other sort of 30-ish%, that is really in that sort of wait and see. And then 10% effectively that say, nope, not going to do it at all. So, really, really interesting, right?
Okay, this is a very insightful, given that all the news blasting still like such a big 31% think they're not available to them yet. So,
that's right.
Yeah, got it. So Chris, just slightly off the tangent there, so for example, the industry news right now, Babylon Health, they're going public with a $4 billion SPAC deal in there. Like, what's your personal thoughts? I know this is not like a Wall Street stock tip in there, but you're in this.
I mean, it just shows, it's a great business model, right? To create operational efficiency. I think the ROI becomes really, really clear on how to leverage some of these different strategies. And, I think kudos to them for getting to a scale to kind of create that market. And so, I think that as we've seen, like in telehealth and virtual health and others, is that where I think we've known as a healthcare industry that these were things that we needed to move forward and actually act on and implement. And seeing solutions, they're not a new company, right? They've been around for a while. They've been building a business, and now the market is really like, we need this. We need these types of engagement capabilities, which is fabulous to see. So I think we're going to continue to see more of it. I think this is not the cooling down of the market. I think the market's just really starting to mature, because most of the investor and venture conversations that we have, they're really educating themselves about the sector and saying, what are the things? And the best thing for the country, what I'm so excited about as somebody who's been in healthcare for a long, long time, is that all of this sort of interest in innovation and funding that's flowing in to fix healthcare challenges, because I don't think government agencies are going to fix healthcare. I think that innovators are going to help fix healthcare, and the providers and the collaboration between those two are what's going to be really meaningful.
Yeah, that makes sense. What about what's your thought between like the Amazon, JP Morgan, Berkshire Hathaway, the Haven project? So why did they fail? What's your
Oh no, somebody's gonna call me. Somebody's gonna call me after this or something and be upset. I think it failed because they didn't realize how hard healthcare was.
Yeah.
Frankly, it's something that being a provider, managing workflows, managing care plans, there's such individualized care. There's not like an app that fixes people, and it's like there's so many components that go into it and the complexity. And so I was disappointed to see that because I was excited about the partnership and they brought some really smart people in, and maybe they brought in too many chiefs and not enough Indians to help build the work around that or something from, an old analogy, right? So that's, I think, one that was a little bit disappointing that they didn't get more traction in the marketplace. But
Yeah, I agree with that. I think recently at the Warren Buffett, his recent meeting, he was saying how before there was healthcare was that big tapeworm on the American economy. That he said, okay, tapeworm won, they lost. It was the tapeworm just very strong, powerful.
that was so wonderful, right? Yeah. And it's much more complex, much more challenging.
I,
And I remember when we would in big consulting agencies to help build patient journeys, right, and workflows, and the patient journey turns into the tapeworm so quickly, you can't fix it. So
yeah, in fact, I think the approach you guys taking that makes a lot of sense. It's almost like for them, they try to solve this big problem, then I think you would lose because the tapeworm is too powerful. Whereas you guys, you have to chip away, right, doing solving a very specific problem. But my hunch is each time you chip away these things, right, you digitizing the
yeah,
problem, you translate, make things more efficient. Then you actually could
if we
solve
can
it.
get people
Yeah.
if we can close gaps in care, cover preventive screenings, if we can just sort of tackle those things, that creates a better model between the providers and the plans and the systems, hopefully is the way to get there. So
Okay. So now that you've been doing the mPulse mobile for a while, what were some of the surprising things that like a couple of things that you learned now?
yeah. I would say one sort of coming to the other side of it is, and you'll sort of laugh at this probably a little bit too, is a good technology company. I was surprised how, two things. I'll give one positive and one negative. I'll balance the conversation. I was surprised how little like API connectivity that healthcare really has, right? And when I refer to that is that there's so little real-time activity happening in many cases. And so when we build a technology platform and to have a conversation with you over these digital channels, you need to, I'll say, hey, Milton, don't forget to go to your appointment this afternoon. And you say, oh, I'm running late. And we say, how late will you be? Will you still make it? And we start this back and forth, right? Or, I can't afford my medications today, and we give you an alternative. If the healthcare world, for the most part, is still in a batch world, and so, and conversations can't be batch, right? If I connect with you and I said good morning, and then tomorrow after the jobs all ran, you said, oh, good morning, Chris. And then another 24 hours goes by and all the jobs run. And then I say, how was your day yesterday? It's painful, right? And so I think we just have to help healthcare move much more to a real-time interaction, with all of our data and making it accessible for, to us because that's what patients can expect, right? From these experiences.
God, that makes sense in there. Uh, Chris, really, really appreciate your time, spending time with us. I guess as we're wrapping up in this, what is there something within the whole AI or patient engagement or telehealth that something that you believe in that the rest of the world do not believe yet?
I think the one that I would say, and I won't say that not everybody's a believer here, is that I think what we're fundamentally trying to solve for with telehealth and with digital engagement is just improving access. Like if I were to break it down, and I don't know if everybody's looking at it as simply as that just says, are there ways that we reduce this, this friction, with just getting connected to providers, with just connecting providers and patients together, with just solve these challenges. And I think a lot of the world is, from a framework of like, oh, patients don't want to engage in their health. People don't care about their health as much. And I don't think that's the case at all. I think people really want to. We see that in the results. We see that by people reaching out. But when the systems are complex, they give up, right? And I think that's where we just have to do a really good job at reducing that friction and just making it really easy for patients to access these different tools, because we've all built lots of great stuff. The providers are amazing. We've got people that really are there to serve them, but when it's hard to get to, they just fall out.
Got it, got it. Then the final question I have is, supposedly you can whisper into President Biden's ear and and just give him plant one idea that he will, tell Congress, right, make it happen in there. What is that one thing you are?
Oh boy, to Congress, I think. And I can't remember the gentleman's name. I think we need to invest more and shift some of the funding around to create, more of this, again, back to this API and this interoperability of data and healthcare data, is that, I think the regulations just bog it down in a way, just like we talked about the simplicity of being able to send a text message and get a response and have an engagement. It feels like there's so much overhead on top of organizations that are trying to do good work that it basically steers a lot of really smart entrepreneurs away from the industry. And I think if we can create some policy and some investment that brings people in to solve these problems, create innovation challenges, create an innovation challenge to solve one of these things that brings people together, and let's use our dollars that way, versus some of the services, and we can actually then bring a lot of people up, versus smaller populations. So I think that would be a big thing to tackle through policy.
I mean, do you feel like that it is necessary in the sense that there's so much like investment, it's almost feel like there's like digital health startup left and right, there are a lot of funding pouring into. I mean, you say you need additional government incentive.
But I think it's the problem. But I think it's identifying like what is the problem that we could solve.
Okay.
And can we focus lots of energy on this one problem? I mean, if from a COVID, we as a nation and a world built a vaccination for this pandemic in such a short period of time, right? Because there was so much focus. Yeah. And so if we really focus on, a few key topics, because if you look around I think there were 180 behavioral health startups that came out of just the pandemic, right? And so they went, wow, this is a big problem. We know this is going to be a trend. I think that one's been getting tackled really well, but it seems like some of the other operational things just get left off because they're not as cool. And I think those, you do have to steer some direction toward those particular challenges. So
okay, that makes sense. That makes sense there. Chris, thank you so much. I really enjoyed this conversation. Thank you so much for sharing your insights. Well, that was really awesome. And also thank you everyone for joining us this week in there. But if you have any questions, feel free to submit it, and we'll pass it to Chris. We'll post it on the recording site later on. And we also be sending out the recording and the slides following this session. And also we have a survey. Please fill that out if you can. And also lastly, we'll be at HIMSS, and I just heard from Chris, you'll be at HIMSS as well. Please definitely come to HIMSS, and we'll see both our company on the trade show floor. And again, looking forward to all of you joining us at the next Telehealth Secrets webinar. And Chris, thank you so much.
Thank you. Thank you. You got an amazing team. Thanks for carving out the time, everyone. Take care.
Thanks.